Welcome, everyone. This is the COVID-19 All Settings Open Forum calls provided by Superior Health Quality Alliance. I'm Barbara Link. I'm one of the senior quality consultants with Superior Health, and I work through MPRO here in the state of Michigan. This is an all settings call provided to the states of Michigan, Minnesota, Wisconsin, and Illinois as well. So welcome to everyone today. This is the second session of a two-part series that we're working with Doctors Without Borders on. We're incredibly excited today to have the presentation on emotional well-being in the time of COVID-19. We'll have an introduction by MSF nurse practitioner Mary Beth Wargo, and then the presentation will be provided by social worker Miss Ebony Lucas and psychologist and MSF wellness officer Dr. Cindy Scott. We're incredibly excited to have them present today. I have just a few housekeeping items and a very unique opportunity to provide to you today. We have some upcoming events. Today at 4 o'clock Eastern Time, 3 o'clock Central. Is your nursing home ready to handle the demands of COVID-19 pandemic? That's assessing readiness, advice from the CDC. If you want that information, Elena will provide that link in the chat for you, and you can access that and register for that event, which is today. We also have our next call that will be Thursday, August 13th. We're switching to the second and fourth Thursday of the month for the summer months. And we are currently taking your requests for presentations. We have some pending presentation topics looking at chronic disease management and COVID-19, as well as myths and realities of COVID-19, but those topics are pending at this point, and we will let you know as soon as we have those topics secured for the month of August. We will have an evaluation posted in the chat, so please let us know how we're doing and take advantage of providing us information and the evaluation when that's posted. We also have a poll today, and Elena will put that in the chat as well. And so that poll is what type of organization do you represent, if you wouldn't mind telling us right now, so then we can get information on the settings that we're providing information for. All right, Elena, would you like to go to the next slide, please? Okay. So just a little bit about us. Superior Health Quality Alliance, as I said, currently is a 5-state organization, and currently our current CMS contract, we're focusing on 3 states, Minnesota, Wisconsin, and Michigan. But we will spread out as we receive our other task orders to the other states. We are currently working on trying to achieve broad national goals / aims set by CMS, and I'll be talking about those a little bit. And we are currently asking people across the continuum of care to join our quality improvement efforts. Elena, if you'd like to go to the next slide. We have 2 high priority areas through our CMS contract. They're focused on nursing homes as well as community coalitions. Through our nursing home work, we are dedicated to that setting to improve the quality of care for nursing home residents, decrease infections, and improve quality scores are just some of the high level things that we'll be doing through our nursing home work. And through our community coalition work, we are improving the quality of care for patients receiving care across the continuum of care through coalitions and improving community setting care. All right, Elena, want to go to the next one? So how we're doing that is through 5 strategic aims or goals. Those are to increase the quality of care transitions for Medicare patients, increase patient safety, increase chronic disease prevention and self-care, and improve nursing home quality of care, as well as improve behavioral health outcomes, and that's including opioid misuse. And so, what we're also doing through that work is actualizing those 5 strategic aims through 3 different strategic approaches. And so, if say, for example, you're working in the behavioral health world and you feel that within your setting you're doing quite well with the care you're providing for your patients, we can provide you tools and information to sort of actualize that through our independent approach. And we can provide you data and certain tools for you, but you'll be working on your own for the most part in that particular approach. Then moving along the continuum, if you're wanting a little bit more of assistance and wanting to meet with other people who are interested in, say, working on a behavioral health intervention, you would join an affinity group, still have access to all the tools and data that are provided to the independent group, but you'll have access to webinars and group interactions with other healthcare entities across the continuum of care within our states to meet and work through some of the interventions targeted, say, at behavioral health care, just as an example. And then on the third strategic approach is a structured collaborative, and that's more intensive. Say you're finding that you're really needing a lot of assistance within developing a behavioral health protocol and intervention at your setting, then we'll almost have something very similar to an echo intervention, if you're familiar with that, where we'll have a subject matter expert and specific sessions that you would attend and have access to a very intensive, structured approach to actualize that, and as much assistance along the continuum as you'll need, getting data, tools, having access to webinars, as well as that more structured approach. So Elena will put a link in the chat that's about how to join. Your organization might have already joined our efforts. That's fine. You can still click on the link and we'll follow up. One of our quality consultants from your particular state will follow up with you and check in with you and see if you've already registered. Great. If you haven't yet, then we'll talk to you a little bit about how your organization can take advantage of either the skilled nursing facility intensive or the community coalition intensive. So we're very excited to offer that opportunity and hope you take advantage of that as well. So with that, please we just want you to be aware that all sessions are recorded. Please mute yourself during the presentation, but there will be questions and this will be an interactive session. So if you want to ask a question, please unmute yourself or put it in the chat and we'll read it off at the end. Please do not disclose any personal health information regarding a patient. And if you're having trouble with Zoom, just chat it in and Elena will help you out. If you have any other questions or comments, you can always chat them in and we'll respond to them. So with that, I will turn it over to Mary Beth for introductions, and very excited and think that you'll really appreciate the information that's shared today from Doctors Without Borders. So thanks so much, and Mary Beth, take it away.
Great. Thank you so much. We're really happy to be here and are excited to share some of the things that we've learned throughout this process, because it really has been a learning experience for all of us. So thank you for hosting. Here today, we're hoping to talk a little about stress and wellness in the time of COVID-19. My name is Mary Beth Wargo, and I'm the Infection Prevention and Control Nurse Manager here in Detroit. So I'll tell you a little bit about myself and the project, and then I'll introduce my colleagues as well. Next slide.
There it is.
I am a nurse practitioner. I've actually done 5 assignments with Doctors Without Borders. And Doctors Without Borders sometimes goes by the name of MSF, and that's the abbreviation for our name in French. So that's where that comes from if you see MSF in some of the documents here. We've been around as an organization for 50 years, and we work in over 70 countries. Often we work in conflict zones, natural disasters, areas where people have been excluded from healthcare, and we also work with epidemics like cholera and Ebola. So we have a lot of experience dealing with infectious diseases, and we provide free medical care. We run hospitals, community outreach programs, and vaccination campaigns. All services, like I said, are completely free of charge, and we're independently funded, which allows us a lot of flexibility on the ground and within our projects. And so when COVID started, we increased the capacity of our projects and increased the infection prevention and control in our projects, similar to how all of you have done so in your facilities. And then we saw the opportunity to also expand, and so we started some projects in Europe, and we're working in nursing homes there. And then as the cases started to go up in the US, we came here. And so we're in Detroit, and we're so happy to be in Michigan. We have gone to, I think, over 30 nursing homes already, and we'll be wrapping up towards the end of this month. One thing that we found with our colleagues in the field is that we're under tremendous stress. And so we have some strategies that we've developed for our longer term projects and our projects abroad that we also brought to this project in addressing staff wellness and overall mental health. So now I'll pass the computer and pass the mic to my colleagues, Miss Ebony and Miss Cindy.
Hello, everyone. I'm excited to be here today. My name is Ebony Lucas. I'm a social worker within the city of Detroit, and I'm also currently the wellness support officer with Doctors Without Borders. I've been practicing in the city of Detroit since 2005. Most of my experience has been as a family therapist. And again, I'm very excited to be here today.
Thank you, Ebony. My name is Dr. Cindy, and I've been working with MSF for the past 12 years in various projects around the world. I guess I can say I'm both surprised and honored to be here today. Surprised because, like most Americans, we never imagined we would be so vulnerable as to this kind of pandemic, but yet here we are. And also honored because we get to stand in solidarity with the healthcare workers that are tirelessly and sacrificially trying to combat this pandemic. I'm also grateful to MSF because the organization continues to recognize the importance of well-being and good mental health in our staff as well as our patients. Well, as Mary Beth mentioned, we've had the opportunities to work in many disease outbreaks, but as a manager, I've been in that dilemma that maybe you've been in, where I'm asking my staff to risk their lives, and at the same time, I'm asking them to work twice as hard to manage the demands of the crisis. So I'm constantly trying to look for ways to help my team to cope and how to stay sane in kind of a crazy situation. But the things we're covering today are not just from our international experience, though. We've been so grateful as we visited homes, nursing care facilities in the Detroit area, many managers, administrators, environmental services, dietary, HR. We've really enjoyed partnering with these very hard workers. So today, what we hope to cover is we want to talk about how to infuse wellness and self-care practices into the workplace during times of stress, identify some practical strategies for wellness, and then talk a little bit about how we can have confidence to meet what's going to be happening next. I mean, if you hear nothing else, the main takeaway today is that during times of this kind of chronic uncertainty and overwhelming needs, wellness and self-care really isn't optional. The duration of this crisis means that we really have to be intentional about strengthening our self-care routines, both personally as well as an organization. Go ahead, Ebony.
I want to pose a question to our audience. Now that you have survived a few months of COVID-19, what continues to concern you? And many of us have survived COVID-19. Some of us have contracted and survived it. And so we're wondering, what is continuing to concern you today the most?
You can unmute or put in the chat.
Well, we know that there are several challenges that are facing our essential workers in our long-term care facilities. I'm often reminded of some of the people that I've worked at in some of these homes. For instance, the CNA who was afraid to come to work, who had lost her transportation, but had no choice because she was the only one left in her family with the job.
Mm-hmm. Yes, and I've had the person who said after having COVID, they were out for a couple months, and they said, I had to choose between my mental health and my economic well-being. So I was forced to come back to work.
Yeah, it's sad. We hear a lot of stories like that. I think about the housekeeping staff who was routinely referred to as the one who works on the COVID floor by nursing home staff. So we talk about the type of stigma that staff is facing, not only out in society, but also in these homes, and they are feeling ostracized and labeled.
And you know, there's managers that have talked to me, they haven't had more than 3 hours sleep for like 3 or 4 months.
Yeah. You know, what about the nurse who contracted COVID-19 and gave it to her mother?
Yeah. And so families have faced the death of loved ones as well as the death of their residents. And over again, we're hearing that it affects the staff differently, say, than in a hospital setting, because many of these residents feel like family members to them.
Yes, indeed. You know, it's really it's a trying situation. In many of my presentations, staff often talk about being verbally attacked on a daily basis by family members who are unable to see their loved ones. You know, they're desperate to see their family members. But instead of becoming irate with the family, staff often kind of rely on each other. They may go outside and scream, or do some other kind of stress busting technique. And it's important that we all incorporate these type of techniques into our daily lives now.
And Elena, I see people are typing into chat. Would you like to say a few of what you're seeing?
Yeah, absolutely. The responses we've gotten so far are the continuing changes in processes and plans, how to keep employees/teams hopeful as we continue to persevere. You can pause there.
Yes. Great. And we have to say, it's not just the difficulties we've seen. We've also been hearing really courageous stories of leadership and strength and resilience and learning and adapting. So this is kind of what we're basing our presentation on today, is the resilience and strength we've seen.
There's one last one in there. And this person is with home care, and they say the lack of social contact with their contacts and the referrals they receive. This person is a very social person and enjoys seeing and talking face to face with their contacts. They just miss seeing everyone.
Yeah, I mean, and this is not just for home care. Many of the
Right.
residents in long-term facilities have been isolated in their rooms for months. I've had managers just crying, saying their functioning has decreased, they've lost weight. And so just watching that when you know how to help the residents but don't have the staff or the time to do that can be so difficult to manage. So let me move to the next part. I just, let's see, I want to highlight a few aspects of stress because knowing a little bit about stress can also help inform how we infuse wellness and self-care into our practices. And for each site, there's different levels of these stress. There's acute stress, chronic stress, traumatic stress, and then there's this kind of stress that we face when we're grieving, and it kind of infuses a lot of things that we're doing. So the first one is acute stress. And, as you know, this is kind of the flight or fight response where our body's made ready to face danger and act quickly. And it's really a normal response to when things are, there's high levels of pressure coming on. And the problem with the fight or flight response is that it can quickly overwhelm our bodies.
Mm-hmm.
Yeah, and I've seen some managers who have been going in this acute stress mode for months and months, and this is really not sustainable.
Right. Cindy, speaking of the fight or flight response, I'm reminded of a nursing home staff who told me that they believe that the fight or flight response had become triggered in them because she believed that she was under so much stress that the fight or flight response was triggered in her. She described a discussion with family members, which turned into a confrontation that she was very surprised about. Her behavior surprised and embarrassed her. And she stated to me, I did not recognize myself. Her staff, her coworkers stated she seemed like a different person, but her body began to believe that she was being threatened. And so it triggered the flight or flight response, when in fact the family was not threatened. They were just concerned and they just wanted to see their loved one.
That's right. So it can have many consequences on our body and our behaviors. So we are really recommending a different strategy. It's no longer, well, I'll wait till the weekend to get enough sleep, or next month I'm going on vacation, because this is such a long-term time of stress. We really need to find ways on a daily basis to incorporate it into our work life. And I have this graph right here where it shows if you spend your day with stress increasing up and up and up, well, by the time you get home, there's just no way you can even sleep. It's just constant building. So what we are recommending is catching it before and bringing it down, catching it, bringing it down. It means incorporating these strategies throughout the day. And of course, everyone copes differently. I think this is an important point. There's no right or wrong way. And you may notice this in your families. Some people, when they're under stress, they get angry. Some people are sad. Some people make a joke. Some people go off alone. There's no right or wrong way. And so we need this kind of grace on our teams to understand that everybody's coping the best in their own way.
Right. Cindy, let me say this. Although everyone may cope differently when it comes to stress, but there are some universal truths when it comes to self-care. There are some things that we all can do to maintain our self-care, which includes getting enough sleep, taking naps, maintaining healthy meal habits, staying hydrated, drinking lots of water. We have to make ourselves a focus. And across the board, these are universal truths that we all can incorporate daily.
Yes. And strategies for the workday, and we'll be talking more about these, is, really making sure, and you've heard this over and over, so it's not really new,
Right.
but making sure you take breaks, take a walk, have a walking buddy, laugh a little bit, and just I set times at different points in the day to check in with myself. How is my body feeling? Have I drank enough water? Are my thoughts becoming more negative, or can I have a positive thought to help me face the day? And just taking a few deep breaths can be magic to bring your stress level down and give you the energy for the next few moments or the next hours. And really, it's important to find a way to disconnect at some point during the day. You could disconnect on a lunch hour and after work. Really detaching and disconnecting is extremely important. Oops, I went too far on my slide there.
That's okay, Cindy.
So, during times of chronic stress, it seems that those who care the most
Right.
are those that suffer the most.
Mm-hmm.
They may feel exhausted and unable to refuel. And this is what we call compassion fatigue. Sometimes when I've been on the floors of our units and I see this person kind of complaining and cynical and blaming everybody else, why am I at work and my rest of my team is at home collecting their benefits? This kind of negative attitude. And then I say to myself, I think this person is exhausted from caring. It's really the people that care a lot. And when compassion fatigue has reached a critical level in our organizations, we see things like a lot of absenteeism, spiraling workers' comp, costs, over high staff turnovers, frictions between employees, friction between management and staff. And all of these things then add additional pressures on the team. And one of the things about chronic stress is when we're so exhausted, sometimes we've even lost the ability to have insight that we are stressed, even.
Mm-hmm.
So, for chronic stress, this is, excuse me, is when we've reached a point of exhaustion. And so we need to recognize that recovery at that point may take time and special effort. I love this quote from Buddha. It says, "Our sorrows and wounds are healed only when we touch them with compassion." So the first step to really addressing this is to be aware that it's happening to me.
Mm-hmm.
I'm at that point where I can't care anymore. I've included a link here to, it's a little self-test on compassion fatigue. And it's very well, it not only measures compassion fatigue, but compassion satisfaction. Most of us go into this work because we get some enjoyment about caregiving, about giving to others. So it measures how much we are satisfied with our work, how much we are fatigued by our work, and it also measures some chronic or traumatic stress. And this is a free tool. You can go online and do a little self-assessment of where you are and begin to recognize where you are. But I really recommend that if you're at that point, you have to make a new plan, because the old plan of recovery is not working. And so I want to highlight a few points on traumatic stress, because this is actually a little different than just all the stress we're facing with COVID. Traumatic stress usually involves situations that are experienced as life-threatening. Now, for some, this is not. They're not facing traumatic stress. Not everybody with COVID has faced traumatic stress, but I think, Ebony, you and I have both seen a lot of traumatic stress.
Yes, we have.
With
Yes.
coworkers we are seeing. So in order for us to have a good plan for recovery as an organization, we need to understand this type of stress. And so the way I see it is, people can suddenly feel panicked when they think about going back to work. Their whole body can react, and it can be triggered by a smell, a sound, a sensation, and it could be just the smell of cleaning fluid can cause someone to feel panicked, so they feel like their body is not in control, as well as this whole COVID thing's not in control. Also, this whole traumatic stress reaction of avoidance. Boy, have we seen this.
Yes.
People just avoiding coming back to work. That's actually a traumatic stress reaction.
Yes.
People avoiding to take the test. I've had nurses tell me, I'm not going to take the COVID test. And when I found out why, they said, well, because I fear that if I take the test, it will make this start all over again if I test positive. It's an avoidance reaction. And then in society, we've seen it because people are just tired of thinking about it. They don't want to wear masks anymore.
That's right.
They just want to avoid the whole thing.
Yes.
And
yes. You know, Cindy, I think about when we do these presentations, how we come in and we often tell the staff, where's your mask? Where's your mask? I had one staff tell me, I don't wear masks because I can't breathe in them. And if I get it, I just get it. And I said, wow.
So, but seeing it not just as people are being oppositional or argumentative, but that avoidance is a common reaction to traumatic stress. And then also this hyperarousal makes people more on edge, alert, quick to argue, quick to get into a confrontation. And also it makes it often difficult to sleep. So just by recognizing these symptoms, it can help our organization be more what we call trauma informed, because the more you can see it as a sign of stress rather than blaming, using punitive methods, or judging people on your work, on your shift or your work teams, this can really avoid re-traumatizing your staff. A trauma-informed approach really requires a lot of clear communication. It's right now we're kind of in a lull. The cases are a bit down. Maybe there's a recovery period. This is the time, though, when traumatic stress reactions are going to pop up even more for our staff, even if it's not the acute crisis. So it's not a time to let down and go back to the way the things were. You have to, clear communication means meeting regularly, giving good information, really actively, as a manager, actively demonstrating that you care for the safety and the well-being of your staff. Provide daily updates and really minimize surprises for your team. Say, this is going to be happening, that's going to be happening. And minimizing these surprising, having some sense of predictability in this time of uncertainty is extremely important. And it doesn't mean we have to have all the answers, but you can show your team that you are actively searching for the answers. Also explaining why you're making decisions, what's behind it, gives some sense of control back to people. This also creates a sense of transparency and starts building trust back with your teams. our teams also need to engage in peer support, because I've talked to many staff who say, I don't want to go home and take this stress to my family. So the more you can get your teams working together to solve problems, to support each other, to help make decisions, the more they will recover from this time of stress, and the more they will give a sense of control back to them, to a situation that feels really out of control. And I do have to mention the cultural and historical trauma, because as we know, this is not, COVID-19 has not impacted all of us in the same way. It's disproportionately impacted people of color. And it's also been a time that has exposed a lot of historical trauma and racism. So people can potentially have these layers of trauma that they're trying to cope with as they return to work. And lastly, I want to talk about this time of grief and loss. Our facilities our long-term nursing facilities are usually very good at facilitating end-of-life processes. Grieving and loss is really a strength that many of our care facilities offer to their patients and residents. But COVID has kind of thrown this off.
Yes.
It's thrown it into chaos. I mean, people say they've lost so many people all at once. They haven't been able to be with people as they are dying, and all the rituals or things we do to grieve have suddenly been taken from them. But we need to understand that grief is really not optional. It's a necessary process for us to go through. I love this quote. It says, "If you hope to avoid grief, then you have to avoid love." So this whole reopening that might be done in phases with COVID, grieving may also need to be done in phases instead of avoided. I worked with one team that said they've just started. They lost maybe 20 of their residents. And so they said the first step was to maybe develop some cards or memories to honor that person. They decided to have a special chapel service. And maybe people have lost family members as well as residents, right?
Yes, Cindy, these things are very, very important when we're talking about grief and loss, because as you know, we work with homes that have lost as many as 40 residents from COVID-19. And then there's the staff deaths. And then there's the staff who also have affected family members. So, you can't have a discussion about self-care without talking about grief and loss, because the loss has been tremendous.
And one site decided to put together a memorial garden. This is a good chance, though, to ask your team what they would want to do, how they want to honor members. One team said they got kind of re-traumatized by seeing these big plastic bags full of patients that were deceased, their personal belongings. So we were talking about ways to make that more of an honoring instead of just these plastic bags of personal items. So it's helpful for the teams to kind of develop a strategy together, and it might be in steps and phases. Ebony, I'll hand it to you because you had some practical tips on promoting wellness.
Yes. Before we end, we just want to talk about some practical techniques that we can do to promote wellness on our teams. And to keep in mind that one of the best tools for well-being is, of course, helping each other. It's important that we are celebrating achievements, praising the small things that you notice others doing. For our managers and our administrators, if you notice an employee coming into work on time every for the full week, it's important to acknowledge that and not say, well, that's what they're supposed to do anyway. We have to praise the small things we see others doing. And then you also want to end the day with something positive. It's important to create an environment where it is safe to speak up, ask questions, and voice concerns. One of the questions that I often ask in my presentations is, are you in an environment where you feel supported? Do you feel like you can voice your concerns and that you will be heard? It's also important to share informational resources and be very transparent, be very open with those resources, and stay updated on current resources. One of the things that we do, when we go into these homes, we create a resource board if they don't have one, where we have a picture of the resource board that we've created at one of the homes, and it lists just different free resources and motivational quotes for the staff, just and different daily self-care techniques that they can incorporate into their daily meetings even. So it's also important to create a wellness committee. The more staff that is involved in these decisions, the more we will restore a sense of normalcy. Some other tips and techniques could be to lead a door decorating contest. This is something that we generally do in our offices during Christmas or during Halloween, but why not do this monthly or bi-weekly? We can talk about self-care stations that are placed throughout the office, and they have chocolates and little hand sanitizers and little lotions, just little trinkets to give to the staff to motivate them. I'm reminded of a manager who told me they keep a self-care station in their office, and when staff come in and get a piece of chocolate or whatever trinket they may have, they ask them, well, how are you doing? It's a way for them to check in with the staff to find out how they're doing. Supervisors should check in weekly with their staff, if possible, one-on-one, even if just for a few minutes, just to kind of gauge the stress level. Another thing that's important is to set up a staff suggestion box. We're used to setting up suggestion boxes for our clients to learn about our quality of care, but how about setting up a staff suggestion box where it is actually reviewed by supervisors and it is actually implemented? Another tip is to host a monthly self-care meetings for all staff that is complete with different treats and just stress busters. And many of these things we can do while still practicing social distancing. So that's important. All of these tips and techniques, incorporate that. It's also important to incorporate mindfulness strategies and self-care practices into your actual staff meetings for implementation and practice. As managers and leaders and directors of nursing, we have to model this behavior. We have to normalize mental health. If an employee needs to take an extra day off or needs to stay longer on a break, we should be in support of that. Okay?
Yes.
Thank you.
Thank you. I love these strategies because I've seen them work, and I've seen many of the managers that implementing these things already. So I guess the big question is how are we going to meet what happened next? What's going to happen next? How can we meet this with confidence? And I've noticed that during this time, we've learned a lot. We've survived. We've adapted again and again, and somehow we found a way to meet this moment.
Yes.
So we do have the tools. We are prepared to meet the challenges that come next, and I think it's really important to convey that to staff. We've done amazing to survive this time, and so as we're reopening, we just prepare people. It can happen where we start and start opening, and then we have to close again. This might happen. We can prepare our families for this kind of reopening. We can prepare our residents. I was talking to an expert on dementia, and they were saying, after our residents have been isolated for so many months, we might think it's a good idea to bring them out into the communal areas, but it might be too stimulating for them after months. So they might need to be introduced slowly to those environments. Maybe do a practice visit. Probably the best way to begin the visitation process or reintroducing families back into the unit is by having outside visits where people can take off their masks if they're actually 6 feet apart. One place actually drew flowers on the ground with chalk and said, well, you can sit in your flower and I'll sit in my flower to help the residents understand. But you can even practice that before the residents come. Of course, we all are worried what happens if there's a new COVID case on our units. And definitely you've put in new procedures for infection control, and you can say, we can meet this if it happens again. We know what to do. But I also would like to encourage you to reflect on, in the past when there were new COVID cases, were you actually happy with how you notified families, how you involved the families? This might be time to kind of think it through and reflect on. If there's a new case, some people have developed scripts. They've identified the person who can go and call families, and it can go something like this, like, Mr. Smith, we want to notify you that there's somebody's tested positive on the unit. We want to reassure you that we have put in place a lot of protections now that we didn't have in the past. We've learned a lot. So, but as you know, it's not 100%. So I want to review with you what your wishes are for your loved one if they actually get COVID. And having a script sometimes will help in these difficult conversations with your staff and being prepared for if there is a second wave. I also want to mention a little bit about returning staff. We talked to a lot of staff who had been out sick with COVID for extended periods of time. And we were really recommending that either HR or supervisors have what we call a return to work interview, where this is a trauma-informed method where you just listen to that staff. What happened? How did it impact you? Here's what we're doing now to make a difference. We care about your well-being. Just that 20 minutes of listening to a staff will work like a treasure for them to welcome them back and transition back to work in a more effective way. And maybe even saying to them, is it all right if I checked back with you in a week to see how it's going? This return to work interview can be like magic to help your teams overcome. And again, I just want to say that new well-being practices, we've mentioned many of them. It's really not a time to go back to the way things were because we're still in the middle of this. So we have to regularly refresh our resources, frequent and clear communication, incentives, staff recognition, and positive time can go a long way to help us through this next time of COVID-19. So now I see comments coming into the chat room. I just really want to open it up for a little discussion or times of questions or comments. Elena, do you want to highlight any questions or?
Yeah, I'll start with a comment that was received a little bit earlier. I think it was answering the question that you posed in the beginning. And this person's concern was of the long term of dealing with uncertainty is taking a toll on their COVID task team. And now they need to rotate their staff even more often.
Yeah.
Oh, that's a great strategy. Yeah. Yeah. So they found a way to cope with it. And the first step is really recognizing it. We can't go back to just doing the same thing. Yeah.
Yeah. And staffing concerns is something that, the nursing homes are all struggling with across the board. And it's a serious, serious issue. And one of the things they often express is how are we going to maintain a quality of care if we don't have the staff to do it?
Yeah. Yeah. A lot of the concerns about the residents they say, we know what to do, we just don't have the staff to do it. Yeah. Any other questions coming in or comments?
Yeah, we also just had a couple of resources that were shared from one of our Superior Health team members. And then we did have another concern that was shared. So this concern is from a Superior Health member as well. And it's for nursing home staff carrying the burden and privilege of caring for residents while responding to multiple regulatory demands. We work very hard to ensure we are supporting our teams on the front line and not causing undue burden. And they just said, thank you to our nursing home teams for your unwavering dedication and sacrifice. And in the chat, you can find some contact information if you need any additional resources or assistance for two of our Superior Health team members.
Yeah, and this is why the regular communication, because of all the guidelines and the changes coming up, even brief huddles every day to keep people updated. It builds confidence that we're giving them the latest information. Yeah. So I see
another comment in the chat. So this one asks, do you have resources you could point to for developing safe and compassionate visits with people who have dementia? As you mentioned, once able to visit with a loved one, it will be complicated. People with dementia will not understand the need for masks and distance, along with not being able to understand why they can't be hugged.
Yeah. Well, and this is where I said some practice, and maybe outside is a good idea, since you can be 6 feet apart and you don't have to wear masks. Making it kind of fun with a flower. I'm going to be in my flower, you're going to be in yours. But also practicing, like tomorrow, just taking people outside more regularly if you have that option. Because I think it's going to happen in phases. I don't think it's going to be immediately we're going to be allowing all the family members to come back in.
Right. You know, one thing that we've seen at some of the homes is that it's important, you know, when we are reuniting, I guess you could say, the family members with the loved ones, is that you can have staff or activities director help with the distancing. So just having a staff that's able to monitor and keeping up a barrier if needed. It doesn't necessarily have to be a gate or a wall, but having a barrier up and then having, just staff who's able to monitor and help those patients who may have dementia, as well as the family, to maintain those social distancing requirements.
Also, many of our facilities have a lot of new staff because at the beginning people have left, and so they may not know the residents as well.
Right.
So I'd like to encourage family members to start telling the stories about their relative to the new staff. Start to create a picture of who they were and humanize our residents. He was a avid fisherman, or she was an executive at a bank, so that some of our new staff can actually know our residents better. So let's see, any other thoughts or comments?
We don't have anything else in the chat right now, but please feel free to continue adding things to the chat. If you'd like to ask a question and you're joined by phone, you can press *6 on your phone to unmute yourself.
Yes, if you want to unmute, that's fine too. I'd love to see your face.
Well, as people are thinking of their questions, Ebony and Cindy, I just really appreciate your presentation today. We do, as you noticed, we have representation from home care and some community organizations as well. And I think that especially putting it in a trauma-informed care context really can spread across any of those healthcare settings, working with patients and helping to support staff. I really appreciate the ability to have that context provided today as well. And I just think some of those tips, Ebony, that you gave about just checking in with staff and such, some of those are, they're free. They don't cost a lot, and mean so much to people.
Yes.
Always we think of these fancy toolkits or whatever we might be talking about how we have to have someone come in and teach everyone some sort of intervention. And sometimes it's just saying, are you okay?
Yes.
How are you feeling today? And I don't want to say it's always as simple as that, but sometimes it's as simple as that. And I really appreciated those tips as well, because, you can look at it as very complex, which it is, to very straightforward. And I think it's important to remember some of those just human kindnesses as well.
Thank you, Barbara. Thank you so much. Another tip is for people to develop or to have a touch point person. So a staff member or a coworker, a peer that you can just check in with daily and just say how you're doing. It doesn't necessarily have to be a manager or a leader. It can be a peer who you're checking in. And when you're not feeling your best, hopefully that peer can take up your slack for that day or speak to a manager or a leader for you to advocate for you. We are each other's best support, and we have to rely on each other.
Wow, that's a great tip. Oh my goodness, that's wonderful.
No, in the chat, we did get another resource shared that was directed at that question or that concern that was posed a little bit earlier about people with dementia. And then we have another comment that says, you mentioned leaders and managers modeling self-care and checking on staff. Do you have resources you can point to for the leaders to be cared for and checked on? Leadership burden is immense, and I think the leaders forget themselves at times.
Yes, that is a really excellent point. And one of the things that we do when we go into these homes, we always check with the leaders and the managers. And we ask them, do they feel supported? Do they feel like they have a network behind them that will give them the ability to support their staff? So we do have specific resources that are directed specifically for leadership staff, and just helping them to maintain a healthy workforce, because as we all know, we don't have healthy staff, we don't have anything, right? So we'll send some of those resources to Barbara, and hopefully we can get those circulated. Thank you.
Great, thank you. Yes, and all of those resources along with the presentation today will be posted for people to access. So we'll make sure you get all those. Thank you.
Great.
We are all caught up in the chat right now.
Good.
Okay.
It's really been an honor to be here today, and we've learned so much from our facilities we've been visiting, and are really quite impressed with, even though there's so many problems, so much uncertainty, we've seen so much great leadership and people who are going above and beyond to meet this crisis. So thank you.
Wow. Thank you. Thank you both, Ebony and Cindy, for your wonderful presentation today. And we can tell that you've really experienced it. So that is always so much appreciated when you've been on the front lines yourself in supporting all of the challenging work that all of our healthcare workers are going through right now, and our families and friends.
Yes.
And we're getting chats in saying what an excellent, wonderful presentation. So you need that reinforcement too. You have done a great job, and so we really appreciate it. And I love Brene Brown and appreciate this quote. I think I will probably print this off and put it in my home office. And then when I get back to work, put it in my cubicle. I really appreciate these sort of things. So it's wonderful and a great way to end your presentation today. Again, we really thank Doctors Without Borders providing Ms. Lucas and Dr. Scott today, and Mary Beth's wonderful introduction. We will make sure that the presentation is posted to our YouTube channel and everyone receives all the links and information that was given out as well. We let's see, I'm just trying to think. We also have our evaluation that link that will be posted in the chat, and our representatives from our other states are also chatting in how you can contact them for further information through Superior Health Quality Alliance as well. So please take advantage and follow the link for the evaluation. We do appreciate your input. Our next call will be on August the 13th, and you'll be receiving an information for that as well. And can't thank you enough today for your wonderful presentation. Thank you so much and your continued work in this important effort. So,
Thank you so much, everyone.
Thank
Have a
you.
great day. Thank you.
Bye-bye.
Bye-bye.